So my name is Cindy Jordan, and I'm the CEO and co-founder of Pyx Health. And this is my colleague, Christina Rice, our Chief Operating Officer. So we thought in order to give you just a brief overview of what we do and show you a little of the flavor of the culture around here, we'd start with a short video. All right. Pyx has always been a social isolation company. So when COVID-19 hit, making social isolation and loneliness an urgent health epidemic, Pyx was uniquely positioned to address it. All right, so how do we do it? There are 3 tenets to what makes Pyx special. The first tenet is intentional delivery, there on the left. You can't build a social isolation platform and expect people to find you. We need to find people when social isolation has a propensity to affect our members' health. So we're going to tell you this story through Janet. She's a typical Medicaid member, and this is her member journey. Janet is a substitute teacher, and she suffers a healthcare event, whether that's going into the ED or an inpatient stay or a behavioral health event. And despite best-in-class care, which you can see right there above the line, Janet still ends up back in the emergency room. Now, I'm sure there's some people online who are Stranger Things fan like I am. So what happens to Janet and what ended up putting her back in the hospital is the upside down. That's the 90% of healthcare that happens outside of the traditional care setting. So you can see what those kind of indicators are. And they start with the idea that she doesn't want to burden her friends and she feels lonely and isolated. Then she loses her job, anxiety kicks in, she has difficulty accessing care, she doesn't have enough money for food, so she stops taking her meds and she's back in the hospital. So as a part of our intentional delivery, we partner with health insurance plans, and they send us a daily census of people like Janet who are going through a transition of care. And this is the first time that our members meet our compassionate call center, and we call them all our Andys. So Andy will use that list and call into Janet, and 67% of the time when we get a member on the phone, we onboard them onto the platform on the first call. Okay, but the problem is so pervasive that we need a scalable solution, and humans can't do it all. And this is where building trust comes in. So meet Pyxer. Pyxer is our empathetic, compassionate, funny chatbot. And you can see there on the left how he interacts with Janet. Pyxer does not treat Janet like a diagnosis or a disease state. He simply acts like a friend, building trust. I personally believe that healthcare technology tends to be data selfish. Like, we build something, we get people on, and then we want to get as much data as possible. We do the exact opposite here at Pyx. When we get a member on the platform, we want to show them that we build some trust, and you do that through humor and levity. It's just like if you and I were meeting at a coffee shop and I sat down, you wouldn't say, "Hey Cindy, how's your depression or bipolar going?" You'd ask me how I'm doing. Important to note here, as you can see on the left, that we're using GIFs and not videos. and our imagery is very simple, because we know that our members are heavily reliant on data plans and are using older model phones. So we take everything into consideration when we build a new feature on the app. So once we have that trust from Janet, that's when we'll introduce evidence-based screenings like UCLA loneliness and social determinants of health. Because we at Pyx believe that loneliness is a social determinants of health, and they go hand in hand. Whenever we put a screening in front of a member, we have a 92% success rate that screening will be completed. Okay, so that brings me to my third tenet, and this is what I think makes Pyx special. It's that combination of artificial intelligence through our very awesome chatbot Pyxer and human intervention, because we can be scalable, but we can also be there when the member needs us. So when Janet tells us that she scores lonely on the UCLA loneliness scale, or she has an urgent social determinants of health need, Andy comes back and reaches out. And sometimes all we do are, companion calls to keep her company. So that's a little bit of what Pyx does. Now I'm going to let Christina share with you some of the data on Pyx's success.
So Cindy talked about our thoughtful approach to technology, which is the key to keeping your members supported, but it's also the most important thing when we're talking about user engagement. So we serve the following populations, and in those populations, we're seeing 62% of members stay active on our platform for at least 30 days. And like Cindy mentioned, that means we're getting 92% of completed UCLA loneliness screenings each month. Our user engagement is within the top 100 Android apps on the market. So think of apps that you and I use like Facebook and WhatsApp. We set the bar really high for ourselves. And Android user engagement is important to our company because 70% of our vulnerable members are on Android operating systems. So the next question really is, does good user engagement mean better member outcomes? I want to spend the rest of our time talking about an independent case study that was conducted, and then I want you to hear directly from some of our members. So we work with large and small Medicaid health plans nationwide. This case study was conducted by one of our early health plan partners in the Southwest. Looking at data early on in our relationship was important to them because they had highlighted Pyx as the innovative member technology solution in their state Medicaid RFP. So in this initial data set, they looked at 12 months worth of claims utilization for 81 Pyx Health members against a control group of 200 non-users. So you can see that the health plan looked at 6 months prior Pyx utilization to 6 months post. And that chart on the right-hand side shows that the control group saw an 11% reduction in that time frame, where the Pyx Health user group saw a 53% reduction. So for us at Pyx Health, 53% was an incredible number, but frankly, it's unbelievable. So the health plan wanted to expand this data set. So this data set did two really important things to continue to validate these findings. The first is they added more users and control members to this study. So you can see we increased it to over 400 Pyx Health users to an over 2,000 non-user control group. The second thing they did that was important was they used a machine learning model to match that control group. So you can see that all of those attributes on the screen were controlled for. It is important to note, though, that this population was a high-risk Medicaid population, and all of these members had behavioral and physical health comorbidities. So what did this expanded case study tell the health plan? Well, really it validated their initial findings. So they found that with statistical significance, so that p-value near zero, that Pyx Health is 36 to 53% reducing hospitalizations after utilization. So this is a huge finding for the health plan and us, and it's really the first case study that we've found that shows when you address loneliness and social isolation, you are able to improve outcomes and cost. And while, of course, data is important, I think we can all agree on that in the office, in the audience. We can never become disconnected to what our members are actually telling us about their experience on the platform. So before questions, I want you to hear from two of our Medicaid health plan members.
My name is Jorge Avila, and I'm 56 years old. And I really enjoy this app. I was down. I was without hope. I didn't care. Now is a positive. I care, I'm happy, I'm smiling, I'm healthy again, and I'm moving forward again. Just for something so simple is doing so much impact in my life that I am so happy about that.
My name is Marvin. I'm a member of Pyx Health. When I'm by myself, I can have someone to talk to. Plus, Rudy's cool, and you would really enjoy talking with him from my experiences. My favorite thing about using Pyx, I like the jokes, and it keeps me positive. When I'm really bored, it gives me good ideas of stuff to go through that I wouldn't normally feel up to doing.
It's very interesting, the way that he presents the things and how he motivates me. That's the biggest thing that he does. And then I smile a lot more, which everybody likes, and I've been improving myself in every way you can think of it, health, mental, and physical.
All right. So having been in the market for 2 years now, addressing loneliness and social isolation, we've learned a lot. So we want to open the remainder of the time to questions, make this conversational, answer any thoughts, ideas you may have.
Thanks, Cindy. Thanks, Christina. It's great to see the clinical outcomes and reduction in cost that has been driven by Pyx. So we have a few questions from the panelists. The first is, how does the data that you're collecting, such as daily mood checks, interact with the patient's care team and existing care goals?
So we take those daily mood checks and some of the evidence-based screenings and we run it into an algorithm on the back end that sort of keeps us in tune with what our members are doing. So, we call it our PEP score. And then we feed this data back to the healthcare plan. So candidly though, not all healthcare plans are equipped to take data in the moment and respond. And that really was the precipice for us starting the Compassionate Care Center and, having our Andys there. Because if you think about care management teams in particular, they have a lot to do, a lot of work. And so we felt like when somebody was lonely, it needed an answer in the moment and maybe not a week later. So we do work hand in hand with care teams and depending on the population, even more so. But what we look at, what we do is like an extension of the care team at the health plan.
Great. And then another question from our panel. Can you speak to how your member results have driven down inpatient admissions specifically?
Yeah, that's what the whole case study was. And, there's a lot of data in that case study. And in fact, we have a data scientist that's pulling together a publishable paper. But here it is. We're talking about high risk BH-PH comorbidities. And so we're talking about people that utilize quite frequently. And so not only did we see the reduction in inpatient stay, but it was in unnecessary inpatient. So sure, people are still going to have health events that are going to put them in the hospital. But what I think that what Pyx did is to prove by treating someone like a human being, being there when they need you, intervening when it gets urgent, addressing loneliness and social isolation, that you can stave off some of those, those non-clinical inpatient admissions, like, because they're lonely or they need someone to talk to, right, or that kind of thing.
Right. And then the final question for you. So the panelists mentioned the digital access as a barrier to social isolation. So how do you work with health plans with patient populations that may have ranging access to technology and broadband?
So we deliberately build for the kind of technology you're thinking of, like Samsung 5. Think that, not the iPhone 11. I'll give you an example. We use a lot of Giphies instead of videos because videos take data, and if they don't, they give the perception that they do. We are really, really, really judicious with our text messages because that eats up data plans, right? So we're 100%, and much to the chagrin of our development team, they'd love to build all these like cool avatars and stuff that just simply won't function with the population that we're serving. And so everything we do goes through the lens of, will this work on the Samsung 5? Is it okay? Will it take our members' data plan? So look, we require that everyone here stays very, very connected to the end user. And, you know, while I would love to have 1 million people, 5 million, 10 million people using Pyx, because I know there's a lot of loneliness out there, we are built to serve Medicaid and Medicare Advantage populations that are at risk.
Yeah, and I want to add one thing. We have a health plan partner that focuses specifically on members with SMI diagnosis. And so even there, you know, there is more technology constraint, but our partnership with them allowed an initiative where they were giving out phones so that people could have access to technology. And the phones came preloaded with the app. And then we helped them onboard to the platform. So there is lots of collaboration that happens with our health plan partners to ensure that if there are barriers, we're able to overcome them.
Great. Thank you to you both.